talk about the public health discipline. Number one is epidemiology. Epidemiology is the basic science of public health. Studies the study of epidemics. Focus on human population, usually starting with an outbreak of disease in community like COVID in 2020. Aims to control the disease of spread of infectious disease, seeks cause of chronic disease and ways to limit harmful exposure. Epidemiologists are mainstays of local public health departments, shoe leather epidemiology. Let's talk about statistics. Statistics is basically government collects health data on the population. These numbers are diagnostic tools for the health of community. The science of statistics is used to calculate risk and benefits. Statistical analysis is an integral part of an epidemiological study seeking the cause of a disease. Statistical analysis is an integral part of any clinical study testing the effectiveness of any new drug. Biomedical science, infectious disease or pathogens. Control of infectious disease was a major public health focus in 19th and early 20th century. Biomedical research is important to understanding control of new diseases and non-infectious diseases, chronic diseases and genetics. Let's talk about the new discipline, that is environmental health science, the classical component of public health. Much of public health improvement in 20th century was due to improved environmental health. Health is effective by exposure to environmental factors such as air quality, water quality, solid hazardous waste, safe food and drugs, global environmental change. Thousands of new chemicals enter the environment every year. Social and behavior science. Behavior is now the leading concern of factors that affect public health. A theory of health behavior is that social environment affect people behavior. Major health threats are tobacco, poor diet, and physical inactivity and injuries. Health policy and management or health administration. This area of study examines the role of medical care in public health. Cost of medical care in the country is out of control. Pakistan has a high percentage of population without health insurance. These people often lack access to medical care. Quality of medical care can be measured and is often questionable. Medical care has eaten up profit that could be used more beneficially for education, housing, and environment. Public health prevention and intervention. Primary prevention prevent an illness or injury from occurring at all. First of all, three types of prevention: primary, secondary, and tertiary. The first of all is primary prevention, that prevent an illness from occurring at all. Second one is secondary prevention, that minimize the severity of disease or injury once it has occurred. Third one is tertiary prevention, minimize disability by providing medical care and rehabilitation services. Public health approach. Define the health problem, identify risk factors. The third one is develop and test community level interventions, implement intervention to improve the health of the population, monitor intervention to assess their effectiveness. Chain of causation, it includes agent, host, environment. It is a traditional approach to dealing with infectious disease. Intervention can focus on any of these targets. This model can also be used for other kind of illness and injuries. Let's talk about why is public health controversial. Difference, the common good, individual responsibility. This is one of the sources of controversy. If we talk about the source of controversy, that are economic impact, individual liberty, moral and religious opposition, and political interference with science.